Hello, my name is Crystal Johnston, and I am an LPN to BSN nursing student at Indiana State University, and I will be presenting my health education project for community health nursing. The title of this presentation is Lead Poisoning and Drinking Water, and I will be discussing how lead in drinking water affects a certain population at risk, which is children under the age of 6 years old that live in economically disadvantaged communities. The learning objectives for this presentation are that the audience will verbalize understanding of how lead poisoning occurs. The audience will describe the harmful effects of lead poisoning. The audience will identify risk factors for lead poisoning. The audience will explain strategies to prevent lead poisoning. The audience will understand how lead poisoning is diagnosed and treated. The audience will identify resources to obtain more information. Before I begin the presentation, I have included a short pre-test for you to complete. Please pause this video presentation and click the link below. There is also a link to a handout to use while following along. In 2014, there was a public health crisis in Flint, Michigan, when 140,000 residents were exposed to lead in their drinking water. This led to other communities around the country discovering that they also had lead in their water supply. It highlighted the prevalence of lead-contaminated drinking water in economically disadvantaged communities, which are mostly comprised of minorities. Even though Flint was declared a federal emergency in 2016, the water in Flint is still not lead-free today. This demonstrates the importance of keeping lead out of the water supply because it's very difficult to remove. Because of the Flint water crisis, there is more awareness today of the lack of environmental health infrastructure and preventative measures in the communities most likely to be exposed to lead in the water supply. So what exactly is lead poisoning and how does it affect the body? Lead poisoning occurs when lead accumulates in the body and can be acute or chronic. According to the World Health Organization, there is no safe level of lead exposure. Any exposure will cause some degree of harm. Lead can be found in many places, such as old paint or homes, but the focus of this presentation is lead exposure through the water supply. This occurs when the water supply system utilizes old piping with lead fixtures that leach lead into the water. The lead enters the body, then stores itself in the teeth, bones, and various organs of the body. Young children absorb 4 to 5 times as much lead as adults. Therefore, the effects are way worse for children. More specifically, lead impacts the development of the brain and nervous system and can have permanent effects on young children under 6 due to their vulnerable stage of brain development. Lead poisoning can cause coma and even death. What are the effects of lead poisoning on children? Lead damages the brain and nervous system the most. This slows growth and development and can cause learning and behavioral problems. Children who have been exposed to lead may have speech and hearing deficits, reduced attention span, lower IQ, and antisocial behavior. Some other physical effects include hypertension, renal impairment, toxicity to reproductive organs, immunotoxicity, and anemia. It is important to understand that these effects are often irreversible due to the vulnerable stage of development of small children. There are several risk factors of lead poisoning, some modifiable and some not. Age is a risk factor because children under age 6 are still developing and are more susceptible to the harmful effects of lead. Socioeconomic status is another risk factor. Children living at or below the poverty level are at higher risk than those above the poverty level. This is partially because economically disadvantaged families are often living in old housing with old plumbing. Poor nutritional status is a risk factor. Children with low intake of other minerals, such as calcium and iron, will absorb more lead. Certain racial groups are at higher risk, with African Americans being at the highest risk. And housing age is another risk factor because old housing has old plumbing and fixtures that are likely to contain lead. As you can see, all of these risk factors are pretty specific to marginalized communities, which is why lead poisoning is so much more prevalent in these locations. Lead exposure is completely preventable. There are many ways we can work together as a community to prevent lead poisoning. Preventing lead from getting into the drinking water supply can be accomplished by establishing more stringent regulations for safe drinking water. This is the most effective way to prevent lead poisoning, and it can be done through advocacy with local government officials and entities. We can also perform targeted water testing in high-risk communities and upgrade piping in old housing. Increasing access to nutritious foods in communities that experience food insecurity will decrease absorption if exposed to lead. Other prevention strategies include targeted community assessment, outreach, and education for populations at risk, as well as improving access to preventative health care, such as regular pediatrician visits. If you suspect lead exposure, contact your healthcare provider or local public health department. They can test lead levels in the blood through a finger prick or even a blood draw from the vein. If lead is present in any amount, follow-up care is required. Early detection and intervention is important with lead poisoning since the effects can be irreversible, so it is very important to follow up with provider recommendations. Treatment for lead poisoning is very limited and begins by removing the source of contamination. This means using another water source, which is usually bottled water. Bottled water can be expensive and inaccessible to economically disadvantaged communities, forcing them to drink contaminated water. At high levels of lead exposure, chelation therapy may be used. Chelation medications bind to lead in the body and remove it through the urine or stool. Chelation medications can have serious side effects, especially in children, and may not be effective for chronic exposure. Therefore, prevention is the most effective strategy to address lead poisoning. In conclusion, lead enters the drinking water through corrosion of old lead pipes and fixtures. All levels of lead in the body are harmful, especially to children. There is no safe level of lead exposure. Lead affects the brain and neurological system and can cause irreversible damage. Children under the age 6 in economically disadvantaged communities are at the highest risk for lead exposure. The best way to prevent lead exposure is to remove it from the water supply. Lead exposure can be detected through blood testing, and treatment includes removing the source of contamination and maybe even chelation therapy to remove lead from the body. But treatment is not always effective, especially for chronic exposure, which is why prevention is the best way to address lead exposure and poisoning in children. I've included resources for more information if you're interested in learning more. Please visit the World Health Organization and Center for Disease Control and Prevention websites. Links are here and also in the handout. Thank you for your time and attention to this crucial public health issue.